When people hear plastic surgery, they think it's just for beauty or for rich people. What does plastic surgery exactly mean, or what do they do?
Well, you see, this is one of the areas where we have a lot of misconception, even within the hospital, talk less of the people outside.
What are the common cases you see in this environment?
Some other problems is some of the sequelae. If a bone that was poorly managed, so they tend to come with some deformities.
Given all you said, what should a person do after born, immediately after born? You're saying they should not go to a local herbalist or apply
they shouldn't.
concussions to their wounds,
they shouldn't.
Their bones.
Yeah.
What about aesthetic and cosmetic surgeries? Is this something we do in this environment? And if yes, what are examples of procedures that we carry out here in this environment? Most persons feel you want to get anything plastic surgery done right, you have to travel abroad for it. What do you say about that?
We have this understanding that anything that is being done by black is most likely tainted or something. But if you go outside, you are likely to meet also most of our training to do those things there.
So you mentioned sequelae of bones that were poorly managed. What are examples of this sequelae? And how can a wound be poorly managed?
Okay. Yeah, that's a very good question, actually. So,
sir.
Good afternoon, Chidi. How are you?
I'm very fine, sir. Please, sir, can you please introduce yourself?
Yes, I am Dr. Sabo. I'm a Senior Registrar in the Department of Plastic and Reconstructive Surgery here in University of Maiduguri Teaching Hospital.
Nice to have you, sir.
Yeah, nice to have you too, Chidi.
Sir, when people hear plastic surgery, they think it's just for beauty or for rich people. What does plastic surgery exactly mean, or what do they do?
Well, you see, this is one of the areas where we have a lot of misconception, even within the hospital, talk less of the people outside. So when people hear plastic surgery, the first thing that comes to their mind is all about beauty, all about aesthetics.
Yes.
Yeah, but that's actually a very big misconception. So plastic surgery does with a lot of things, okay? We have the reconstructive part, and then we also have the aesthetic part. That's the part that does the beauty. Then we also do a lot of reconstructions. So we see cases like burns, wounds, scar problems, okay? Even some defects that people are born with, okay? So these are some of the things that we also deal with inside and also outside the hospital.
What example of defects do you handle under plastic surgery?
The defect comes in different ways. One of the defects is if somebody has a large swelling, a tumor, okay, in which after removal we need to find a way to cover it. All right. Sometimes the defect may be a wound, a large wound that we have to find a way to cover it. Sometimes we use some person's skin to cover the place. Sometimes we get a chunk of tissue. In fact, we can even lift it up from the thigh and then use it to cover the area. We use a lot of interesting things sometimes, just to cover the defect.
All right, thank you, sir. So, sir, what are the common cases you see in this environment?
Yes, what is peculiar to this environment is we see a lot of cases pertaining burns. Okay, you see burns from hot oil, sometimes hot water, kerosene, sometimes even gas explosions. These are some of, or from car accidents. Some of these causes significant burns, and we see them from different range, children, adults. And then the other thing we see is wounds. We see a lot of wounds. We call them ulcers, on the skin. The wound will not heal for too long. So these are the kind of wounds that actually come to us, and we try to make it look better, and then the patient will now heal well and then go back to their society as early as possible. These are just some of the common things that we see in the environment. Some other problems is some of the sequelae. If a bone that was poorly managed, so they tend to come with some deformities. So we tend to correct those deformities, so that the patient can regain their function as early as possible.
All right. Thank you very much, sir. So you mentioned sequelae of bones that were poorly managed. What are examples of these sequelae? And how can a wound be poorly managed?
Okay. Yeah, that's a very good question, actually. So the sequelae, we see them ranges from different severity of the bone and the location of the bones, in the face, for instance, especially those that come down with acid burns to their face. So they tend to have problem in opening and closing their eyes. So, and then sometimes you have, especially if you have bones around the mouth, you also have difficulty opening the mouth. Then on this hair or on the scalp, sometimes the hair may not grow back, so they tend to come down with alopecia.
Okay.
Then one of the common things is, especially if you have the bones on the neck region, so the neck will just get fixed and they may not be able to open it up. So also, and of course, on the joint, on the hand, the patient cannot open the hand. So those problems, once the patient has it, they make it very difficult to live the day-to-day life, to perform their normal routine activities. So that's why they have to come to us so that we can be able to correct those problems. Yes. Then with regards to, what was the second question again? Sorry.
How can a wound be poorly treated?
Yeah, so one of the problems we encounter is because of our traditional practices.
Okay.
So we find out that most of the patients that have wounds, they have history where they use all these traditional herbal concoctions. Yes, some use raw egg, some use some even toothpaste, engine oil, okay? Some even animal furs or animal dungs.
Yeah.
So all these are things that actually complicate wounds, and wound will not heal within the expected time, but rather it will take long.
And then come with complications.
Exactly, then they come down with problems.
Okay, thank you, sir. Given all you said, what should a person do after born? Do immediately after born?
Yeah, so having the knowledge of what to do actually immediately after somebody sustained born is very crucial. It can be the difference between saving somebody's skin to preventing that person from coming down with all those problems that I mentioned. So the first thing to do is, whenever somebody has a bond, the most importantly is try to remove the patient or the person from that source of danger. Okay. So while after doing that, then you get a water and apply or cool the place using a running water.
Okay.
So cool down the place. You can allow the water to run over the area for like maybe 10-15 minutes. Okay. So that the place will get cool. You don't need to apply anything. So just cool down the place, cover the area with a very clean film or something that is not contaminated, and then you can now take the person to a facility where you have a specialist. If you don't have a specialist, you can take the person to a nearby hospital so that the person can receive appropriate care before a specialist will now be invited to review.
Yeah, thank you, sir. So you're saying they should not go to a local herbalist or apply
no, they shouldn't.
concussions to their wounds,
they shouldn't.
to their bones.
Yeah, they should.
Noted, sir. What about aesthetic and cosmetic surgeries? Is this something we do in this environment? And if yes, what are examples of procedures that we carry out here in this environment?
Yes, actually, aesthetic surgery, like I mentioned, is one of the very important component of plastic surgery. So we see a lot of patients that come with, they come in different ways. Some will just come that they want to have a surgery, but they don't want a scar, or they want a very minimal scar. So as plastic surgeons, we have a way of concealing that scar. The scar will not be prominent. So yes, it's something that we do here, but it's unfortunate that some are not aware that we tend to offer those services in Maiduguri. So we see a lot of scar revision. Okay, some come with excess abdominal panel, so we call it excess abdominal fat. So especially those women that deliver or have some weight loss, post-weight loss body changes. So they tend to come down for us. They're looking for how we can do some aesthetic procedures to make their tummy flat. Yeah, so we do abdominoplasty, and then we also do some liposuction. Okay? And other things we do is, especially those patients that have a lax breast, we call it ptosis, breast ptosis. Okay, so we do breast reduction, or we can even augment it and increase it. So all those things are things that we do, ranging from even rhinoplasty. We change the shape of the nose. Yeah, sometimes some aged women or even men sometimes have all these right teeth, wrinkles, so we tend to correct them. So these are some of the aesthetic things that we can offer in this environment, among many others.
That's very interesting.
Yeah.
Thank you for letting us know.
Yeah. The whole thing is about awareness. Yeah. Once people are aware, it's not a big deal. So once you have a cordial relationship with your patient, you understand the outcome. It's a service that we offer.
So is it safe to have these procedures done here? Because most persons feel if you want to get anything plastic surgery done right, you have to travel abroad for it. What do you say about that?
Yeah, I think that's one of the major concerns that our people here have.
Yeah.
It comes down with, we have this understanding that anything that is being done by black is most likely tainted or something. But if you go outside, you are likely to meet also most
Black
of our training
doctors.
to do those things there. I remember in Turkey there was this black man. He does a lot of aesthetic surgery. So, and people are surprised that he's actually from Nigeria. So the thing is, yes, it's safe. The most important thing is you just need to find somebody that knows what he's doing.
Has the skill.
Yes, has the skill. So, but it's safe anyway. Most importantly is just having the right person, because like I told you, sometimes you have a lot of quacks doing some of these things, and unfortunately or sadly, some patient will fall into those in the hands of all these people. Yes, and that's where you see a lot of problems. We are not saying these procedures are 100% safe. No, nobody can guarantee you, give you that assurance. But what we can say is almost 90% of cases you do them without much problems. Yes, and most of the time the patient usually is happy with the outcome. Yes.
All right, sir. So one last question.
Yeah.
What is your message to the general population, and what is something you would like to tell a young doctor like myself and so many others that are going to be watching this that are planning to get into plastic surgery?
Okay, so what I want to advise the community is, in this our era, information is key.
Yeah.
If you don't have the right information, you are not likely to get the appropriate care you're supposed to have. So in as much as we try as much as possible to highlight or to educate people through several means, try to educate yourself. Plastic surgery is not something that is very hard to get. You have it in your doorstep. So it's just for you to now look for that services, and you shall get it. And then a very important thing, especially when it comes to things like burns, please try to spread the information across other people. Yes, because whatever you say, you may not be the difference between saving somebody's life and then somebody having all those problems that we mentioned. Yes. So you should try as much as possible to spread the information so that people can actually benefit from that. And as for the young doctors coming into this field, yes, it's a very lucrative field, especially if you know what you're doing. Yes, but one has to be very careful, because it's another problem is one of those areas that you have a lot of litigation. Exactly. So one has to be very careful. Know your limits. That's just the key. Know what you can do and then things that you can't. And then always try to have a cordial relationship with your patient. Try to be realistic as much as you can, because some patients come expecting some magic or something that is beyond doable. And so you need to make sure you lower your patient's expectations. Yes, so that's just the main.
Or give them a realistic expectation.
Exactly, realistic expectation. Don't lie. Don't give too much expectation. If not, you always fall into trouble. So that was the final message.
Thank you very much. It's nice to do this with you.
Yeah,
thank you so much.
Nice to have you too.
All right,
thank you very much.